We are talking 250,000 children because of your irresponsible shutdown of programs that Congress had fully authorized and you unconstitutionally shut down. How do you feel about being responsible for hundreds of thousands of children dying because of your sudden interruption in these key programs?
New administrations come in with new spending priorities. That's what we were doing.
I find your response both ignorant and callous, and the interruption of these programs was carefully detailed by Secretary Rubio. Elon Musk addressed them as well.
When a government official sits before Congress, the last thing they expect is to be accused of deception to their face. But in this explosive exchange, Senator Jeff Merkley doesn't just question Russ Vought, he dismantles the entire premise behind his proposed cuts.
Thank you very much, Madam Chair, and welcome, Director Vought. You mentioned that your pocket rescissions were misunderstood. Are you pledging us today that you will do not submit rescissions within 45 days of the end of the fiscal year?
I'm not making that commitment. I'm saying that no decision has been made with regard to any additional rescissions package or the timing of those rescissions package.
Well, colleagues, I really want to emphasize that this strategy of using delays and freezing and impoundments and slow-walking contracts and rescissions, partisan rescissions, pocket rescissions at the end of the fiscal year are all part of an unconstitutional plan to steal the power of the purse from Congress, as stated in the Constitution, and put it in the power of the President. Mr. Vought's previously told me that he strongly believes that the Impoundment Control Act of 1974 was unconstitutional. That will get to the Supreme Court. But I want to be clear, the U.S. Supreme Court has already ruled twice on the question of whether or not the power of the purse resides with Congress. And I consider this multifaceted strategy to be a huge attack on our Constitution. And I regret that you've undertaken it, as in you'd made a pledge to the Constitution, an oath to the Constitution, not to the President of the United States. I did find it concerning in your testimony that you note life-saving treatment. No life-saving treatment will be impacted by this package. Do you consider any life-saving treatment to have been halted by the January 25th 90-day freeze on AID?
We do not believe that life-saving treatment was halted through the various reviews. Certainly not the direction of policy officials. Throughout the first month, there was malicious compliance at times, and we worked through those as an administration. But it certainly was never intended to be halted.
Well, I consider that to be a huge deception that does not do justice to the truth. On January 25th, a 90-day freeze was announced halting PEPFAR. 60% of the PEPFAR staff was fired. Rubio announced that he was ending 5,200 of the 6,200 USAID programs. He then announced that 82% of USAID program was being shut down, and the remaining 18% would be transferred to the State Department. This resulted in a sudden collapse of malnutrition programs, tuberculosis programs, malaria programs, AID and HIV programs, and Boston University has put together a tracker of the impact of this sudden shutdown of these programs around the world. Let's review the child death count from the Boston University School of Public Health tracking of the impact of your shutdowns. 77,000 children have died up to today, their estimate, from pneumonia as a result of the shutdowns. 70,000 children have died from malnutrition. 59,000 have died from diarrhea. 33,000 have died from malaria. 7,000 infants have died from HIV, plus 118,000 adults. We are talking 250,000 children because of your irresponsible shutdown of programs that Congress had fully authorized and you unconstitutionally shut down in partnership with Elon Musk and the Secretary of State. How do you feel about being responsible for hundreds of thousands of children dying because of your sudden interruption in these key programs?
I reject the assertion. I'm happy to take a look at the tracker that you describe. Every administration has the ability to do a programmatic review when they come into office. In fact, that was articulated earlier by one of your colleagues, the extent to which new administrations come in with new spending priorities. That's what we were doing. There was great malicious compliance with regard to the funding halt that you're referring to.
I find your response both ignorant and callous, and the interruption of these programs was carefully detailed by Secretary Rubio. Elon Musk addressed them as well. When I asked Rubio here in the Senate about whether it was Elon Musk that drove these shutdowns. He said no, he had personally reviewed these contracts himself and his own statements about shutting down 5,200 of these programs. For you to come before this body and say that this vast shutdown of 82% of what USAID had no impact on human life just shows that you chose to make decisions totally out of sync with the Constitution. You were plenty welcome to put forward a budget for the next year. You were plenty welcome to veto any bill that we passed in the House and Senate. You could use your influence in all kinds of ways in the future, but you chose to shut down programs in the middle that have resulted in hundreds of thousands of children dying in the last few months. I find that abhorrent, and few Americans have ever had such a devastating and disasterly impact.
What you just watched wasn't a routine policy disagreement. This was Senator Jeff Merkley laying bare what many experts have warned for months, that the Trump administration's freeze on global health aid was not a bureaucratic hiccup. It was a catastrophic policy choice that accelerated death, destabilized health systems, and violated one of Congress's most fundamental constitutional powers. Merkley wasn't just challenging Vaught's decisions, he was calling out an entire governing philosophy built on executive overreach, secrecy, and the willingness to gamble with human lives. To understand the weight of this exchange, you have to recognize how extraordinary it is to hear a sitting U.S. senator accuse an administration official of enabling the deaths of hundreds of thousands of children. That is not political theater. That is a reflection of the severity of what actually happened when the administration froze PEPFAR programs, halted USAID operations, and gutted global health initiatives that Congress had already funded. These weren't abstract programs. These were the pipelines that kept anti-malarial drugs flowing, that delivered HIV treatment to mothers and infants, that funded frontline clinics managing pneumonia, diarrhea, tuberculosis, and malnutrition, the very illnesses that disproportionately kill young children. When Merkley recited the Boston University School of Public Health's impact estimates, he wasn't exaggerating. Those numbers represent the real-world consequence of abruptly shutting off life-saving programs in low-income countries whose healthcare systems cannot absorb shocks of this magnitude. In regions where malnutrition treatment stops even for a week, children die. Where antiretrovirals suddenly disappear, HIV transmission spikes. So when Vought insisted that no life-saving treatment was halted, Merkley responded with moral clarity, calling the statement a huge deception. Because the reality that the freeze was not a symbolic policy review, it was an immediate shutdown of 82% of USAID operations. Staff were fired, programs collapsed, contracts were terminated, clinics went dark. His second point, the constitutional crisis element, is just as important. The core of his accusation is that Vought and the administration engaged in what he calls an unconstitutional plan to seize Congress's power of the purse. Congress decides how money is spent, period. The Impoundment Control Act exists precisely to prevent presidents from draining the legislative branch of that power. Merkley is warning that this administration's freeze, delay, rescind strategy is not just bad policy, it's an attempt to rewrite the Constitution by practice. If allowed to go unchallenged, it creates a precedent where any president can simply refuse to spend money they don't politically like. It's also why Merkley pressed Vought so hard on the legal reasoning behind his decisions. Vought openly believes the Impoundment Control Act is unconstitutional. That admission matters. It signals an ideological project, a belief that the president should have unilateral authority to ignore Congress's spending decisions. And Merkley is right to call out how dangerous that is. As soon as presidents can pick and choose which laws to follow, the balance of power collapses. And while all of this constitutional theory matters, Merkley brought the debate back to the human toll, because policy choices have consequences. And in this case, the consequences are measured not in dollars, but in children's lives. Children in African and Asian nations whose health systems rely heavily on continued U.S. support. Children whose deaths now appear in mortality trackers and academic reports. Not because of natural disaster or war, but because of a deliberate political decision made in Washington. The hardest part of Merkley's questioning is that he forces Vought and the American public to look directly at the question most officials never have to confront. What does moral responsibility look like when your policy choices cause preventable deaths? Vought rejected responsibility, but the data, the timelines, the internal memos, and the testimony of the agencies affected tell a different story. As Merkley said, Americans rarely see a federal official preside over such devastating global consequences. And that's why this hearing matters. It's a lesson in governance, a reminder that competence, respect for law, and humanitarian values aren't optional. If we want a government that protects life, honors constitutional limits, and respects global commitments, it takes hearings like this. It takes senators willing to challenge power, and it takes voters willing to demand leadership that doesn't play political games with human lives. If this breakdown helped you understand the stakes more deeply, make sure you subscribe, like, and share, because these are the conversations that shape the future of U.S. policy and global health.